Hello, everybody, and welcome to this week's Capitol Report. I'm Julie Bartke. The 2014 legislative session had hundreds of new laws go through the books. Some of the high-profile issues will have their oversight by the Department of Health. Joining me to talk about some of those issues, we have Commissioner Ed Ehlinger. Thanks for joining us, Commissioner. We appreciate your time.
Good to be with you, Julie.
Commissioner, I want to begin with one, arguably the most high-profile issue this session from a policy standpoint would be the medical marijuana bill, and which is now law. You're not necessarily a proponent of it. You weren't during session, but is the final package one that you can support?
Well, first of all, we speak about medical cannabis and recreational marijuana. They're two separate things. And certainly we, in my testimony initially on this, was we don't know enough about cannabis and its effects on people. We don't know its positive effects or its negative effects. We have not had enough studies. But it became real obvious that there was a public demand for some kind of approach to medical cannabis. So we worked with the authors to develop a bill that I think really put a good compromise together that allowed us to gather some information and make the medical cannabis available to people who really needed it. We'll get some information that'll help us in policy decisions down the road, and people will get the medication who really need it.
Now, there seemed to be a real sense of urgency among these parents who are testifying at committee after committee, who brought in their small children who they believe could benefit from this. Do you find that sense of urgency within your department as well, then, to begin the implementation process? I know that there are set deadlines, but is there just like a sense of getting this thing going?
Well, certainly there's a sense of urgency because the legislature said we have to get this program up and running within a year. And for a program of this complexity, that timeline is going to be really tight. We have to get growers, we have to get a distribution mechanism, we've got to get a registry system up and running, we have to do some quality assurance, we need to look at dosages and schedules. There's a lot of things that need to happen here. So there's a sense of urgency in terms of getting this program up and running. Certainly there's a sense of urgency for any person or group of individuals who have some kind of chronic condition or some condition that's causing them problems. So we do sense that there's a sense of urgency for the people who are going to be using medical cannabis, but also for a lot of other folks who we're constantly looking for ways to really meet their needs.
Commissioner, let's move on to electronic cigarettes. The final bill essentially bans the use of them in schools. It restricts marketing measures towards minors in particular. It didn't go so far as to restrict e-cigarettes in public places, which at one point was the Senate position. So again, your agency is going to help implement and enforce this. Where does it stand at this point? And do you support the final package?
Well, we certainly think that there needs to be restrictions on e-cigarettes. It's a nicotine delivery device, and nicotine is addicted. And we know that kids are using e-cigarettes in increasing numbers. The use has doubled over the last couple of years. So we see this as a big public health issue. So putting restrictions on it, we would have liked to have seen the final bill be a little bit broader to include e-cigarettes along with all other kinds of cigarettes restricted in public places. We didn't quite get there, but they certainly have lots of restrictions on sales to minors, marketing, displays, promotions, those kinds of things. So I think this is a step in the right direction.
Okay, Commissioner, let's talk a bit about something you testified on early in session. Advancing health equity. The report recently came out, and you spoke to the Senate HHS committee on this, highlighting some of the key concerns. Do you think your message was heard this session?
I definitely think that people are resonating to the report that we put out on advancing health equity. I think certainly communities of color and American Indians, low-income populations throughout the state have seen this as really a way of articulating what they've been telling us for many, many years, that there are certain groups who are disadvantaged in this state because of policies and systems. We labeled it as structural racism, and I think we've got a lot of response back saying, yes, that truly is there. And people heard us, the legislature heard us, and they gave us some resources that we had not even asked for. And I think they were really encouraged by the community coming forward saying that we need to look at physician workforce, we need to look at advancing health equity and the kind of data that we collect. And I think one of the biggest things that really is advancing health equity was the passage of the minimum wage. That was probably the biggest public health bill of the entire legislative session. Because our data show that if you can increase income from the lowest quintile, the lowest 20%, to the second lowest quintile, or the next step up, you can increase life expectancy by almost 4 years. That kind of an investment at low income levels, and that particularly affects people of color and American Indians, has a huge impact. So minimum wage really is a public health policy, not just a jobs policy.
So how would you take what the legislature did this session and build on that next session, given the opportunity?
Well, now we've had 6 months of talking about our report. The legislature is really looking at different ways that they can move forward. The community is coming forward with lots of packages. We will be doing a lot more work on our grant policies, and we're granting for populations of color and American Indians. We'll do a lot more data collection and data analytics. We will probably be putting out some more reports, like we put out an income and health report, which looked at minimum wage as a public health issue. We'll also we'll be looking at things like paid parental leave and sick leave, and how that impacts populations of color and American Indians particularly more than the white population.
Any specific legislation that didn't pass last year that you might want to try to carry forward? I'm just thinking, for example, of the free breakfast for all program. That affects a lot of the lower income folks as well.
Yeah, well, there's certainly a lot of things that we thought about, but this was an unsession. This was a short session, and so we really wanted to kind of hold back and do a lot of the unsession kinds of things. Like, we did the Local Public Health Act, which we got through, which is, most people won't recognize it, but it solidifies our relationship with the state health department, with local health departments. It's a really important thing for everybody in the state. Yes, there are lots of other things, but we'll just line them up for next year and go from there.
And you're pleased?
I'm very pleased. I think the last 2 years of this this biennium has been a great couple of years for public health. We got across a really good agenda. I think the people of Minnesota will benefit from it economically, but particularly in their health.
Okay, Commissioner, we have covered a broad variety of topics here, and we appreciate your time. Thank you for coming in.
Well, thanks for asking me.